Hello, I am Dr. Laureano Rementeria from Clínica Rementeria in Madrid, Spain, where I specialize in advanced techniques in cataract and corneal refractive surgery. Accurate biometry helps ensure good presurgical measurements for intraocular lenses, which are critical for a good visual outcome. The ARGOS SS-OCT biometer uses swept-source optical coherence tomography to quickly acquire accurate biometer measurements for cataract procedures. I conducted a study to analyze the refractive accuracy of the ARGOS device in short and long eyes implanted with a monofocal IOL. In this observational retrospective study, I examined eyes with short or long axial length bilaterally implanted with Acrysoft IQ monofocal IOLs. Prior to surgery, the ARGOS biometer was used to acquire measurements and calculate the IOL power. 1 month after the surgery, we assessed monocular and corrected distance visual acuity and auto-refraction. Key endpoints include visual acuity and absolute prediction error. Mean monocular and corrected distance visual acuities for short and long eyes 1 month post-surgery were 0.03 and 0.1 logmar, respectively. Mean spherical equivalent different between short and long eyes, but mean cylinder was comparable between groups. For short eyes, we observed a difference in mean prediction error based on formula used, with values of 0.19 diopters for the Barrett Universal 2 and 0 diopters for Barrett through axial length. Mean absolute prediction errors were 0.32 and 0.29 diopters for Barrett Universal 2 and Barrett through axial length, respectively. Median values were 0.27 and 0.28 diopters for these two formulas, with no significant difference being detected. 76 and 83% of patients, respectively, had a prediction error of 0.25 diopters or less, and all had an error 1 diopter or less with either formula. For long eyes, mean prediction error did not differ based on the formula used. Similarly, mean and median absolute prediction error were similar with both formulas. Mean absolute error was approximately 0.3 diopters with both formulas, and median values were 0.28 and 0.27 diopters with the Barrett Universal 2 and Barrett through axial length formulas, respectively. 80% of eyes had a prediction error within 1/2 diopters, and 100% were within 1 diopters, regardless of calculation formulas. In this study, the ARGOS SS-OCT biometer provides excellent presurgical measurements for both short and long eyes, contributing to favorable outcomes 1 month post-surgery. The Barrett through axial length formula was slightly more accurate than Barrett Universal 2 for short eyes, whereas the two were comparable for long eyes.